name is Cindy Rifenburg, and I'm the Academic Fieldwork Coordinator at Lehigh Carbon Community College. And I'm going to talk to you today a little bit about how to work with the challenging fieldwork student, students who are occupational therapy assistant students. However, this information would also be helpful if you're working with an occupational therapy student. And I want to also point out that there are some really important resources available for you through AOTA's website on how to work with fieldwork challenges, as well as score the information, prepare objectives. So just as a reminder, please utilize those resources. They're very helpful. So let's cover a little bit about what we've talked about so far. So first off, remember that you need to have objectives in place. Hopefully you're working with your academic institution to do that. You also want to prepare the environment to have a student, as well as prepare the fieldwork educator. As long as those things are in place, that's a good step in the right direction. You also want to make sure that you're comfortable providing feedback to an occupational therapy assistant student. And remember, communication is one of the biggest keys to making fieldwork successful. And that communication should be in writing as well as verbally. And also remember to review the progression of an intern from beginner, new beginner, all the way up to competent, which is what we're looking for at the end of a fieldwork, is that the student will show you entry-level competence. So let's look at what happens now if you have a challenging student. So let's compare students who are what we consider typically progressing. So things that you're going to see is a typically progressing student is going to make progress every week. Some weeks there'll be big steps, other weeks it'll be small steps, but there's always small gains made every week. They may need occasional reminders as they're learning a new skill, but typically after they've been given a reminder, and maybe two, they can follow through with the requirement with very few tips or follow-ups. They're able to continue to do that skill, or perhaps communicate with a team member or present a team with very few additional cues. Typically, progressing students also tend to use their own time for learning, and they take that initiative. They don't need to be cued or reminded to go ahead and look up a resource or go collaborate with the physical therapist. They'll do some of that stuff on their own, again, after that initial cueing. Typically, progressing students ask a lot of questions, and they're starting to show you their clinical reasoning. That's really important to see also. They also can use that three-step learning process, which means that they can observe it, they can practice it, and then they can perform it. And that practice can be on their own, the practice can be on a patient or a client while you're there supervising, and eventually when you feel that they are again demonstrating competence, they can perform that skill on their own. So how does that compare to a student who's moving a little bit slower in their fieldwork process? So students who are moving a little bit slower, things that you're going to notice is they need to be reminded quite often about completing a task. And when you do remind them, they may follow through at the moment, but then the next day they seem like they didn't hear that cue or reminder, and you're starting back from scratch. So you need to remind them repeatedly or cue them about particular skills or tasks that they need to perform. They also seem to have challenges with grading treatment. So when you provide a client that the student is working with, and the student needs to modify the treatment activity to make it either a little more challenging that day or perhaps downgrade it a little bit because maybe the client is not feeling well, the student really struggles with being able to grade. Oftentimes you'll see them trying to use the same treatments again and again with very little change from day to day that really reflects the client's status that time. They also struggle with time management. Now, lots of new students do struggle with time management, especially in the beginning and as their caseload builds. But what you'll see with a student who's really struggling in the fieldwork is they have challenges with time management that show up in multiple ways. Getting their documentation done on time, making sure that they begin and end their therapy sessions on time, planning ahead for how long a treatment might take. How long is it going to take for them to do this ADL and then perhaps work on a cognitive activity in the clinic? So they really have difficulty judging the time that things are going to take and keeping track of their time. When you ask them about their clinical reasoning, they also are going to struggle. They really can't articulate why they've chosen what they've chosen or how they've set it up to meet those specific client needs. And when you try to communicate with them, they often seem like they're struggling to communicate effectively. Either they're not able to point out the important parts and discuss it with the team or the family members, or they seem to kind of fall back and need you to prompt or cue them to talk about what seem to be the important components during the treatment session. Now, occasionally, you're also going to have a student who is really in your top 5%, one of your fastest progressing students, and they are well above and beyond your average student. So things that you might see with them. They typically learn the skill by observing it one time and get right in there and practice and are very competent very quickly with a particular skill. They take on new tasks easily. When you ask them about their therapeutic or clinical reasoning, they can really give you good descriptions, good explanations, and they're very comfortable looking up either research or literature to help support some of the ideas that they've chosen. They do follow through on your feedback, and when you give them tips or instructions to perhaps communicate more effectively during the team meeting, something like that, they will follow through. You don't need to remind them a second time. They can handle a client caseload quite comfortably, because remember in the beginning they're only handling a few. At midterm they're about half of the caseload, and by the time that they're at the end of the fieldwork they're carrying a full caseload. And individuals who are really in your top 5% handle that very smoothly and do not get flustered. They're very calm and very professional. They also can communicate very clearly with the team members and the client's family. So what happens when you do have a challenging student? There's a few things that can be helpful for you to consider. If you feel like the student is running into difficulty and you're not even sure, sometimes therapists who are supervising say, am I seeing what I think I'm seeing? It's always helpful to have another clinician in the room or in your department observe or work with the student intern for a client treatment. This way they can also observe the same things that you are, and when you get together you can discuss that, because sometimes a new supervising fieldwork educator may be unsure if what they're seeing is typical student performance or something that's not what they were expecting. It also helps for you to self-reflect. Some students, and we all know this, can push our buttons. Why is that happening? Well, we need to self-reflect and decide, does that student remind us of someone? Is that student becoming frustrated by their lack of communication? I think all fieldwork educators need to reflect on the challenges that they experience when they work with a student who may be difficult. Also know your own triggers. And last couple things to think about. You're there to help the student become the kind of therapist that they want to become. They don't have to be exactly like you. So recognize that not all students will want to stay late even if you do. They may have other obligations and feel pressured to leave on time. You may like to stay late and look through some additional documentation or collaborate further with the team member. As long as a student has completed the requirements that they need to for the day, they may be more anxious about getting out of there, perhaps to pick up their child from childcare, or perhaps to take care of an aging parent. We don't always know what students are doing behind the scenes, so it's important for us to be sensitive that they may seem like they're distracted, but it may be that they also have other responsibilities outside of their field work. Last thing to think about is when they get down to documentation, remember the student is developing their own style of documentation. It doesn't have to be exactly like yours. So do think about that. You want to support their style, but by giving them tips. So when you have observed performance in a student that you feel is not at the level that you were expecting, write down your specific observations. Those are the kind of things you're going to need to share with the student during one of your meetings. When you do sit down with a student during one of your formal supervisory meetings, do let them know that you have concerns and give specific examples about what you've observed, either a particular treatment with a client, an interaction with the team, so that the student is aware of exactly what the problem concerns are. Then go back and let the student know exactly what you'll expect to see the next time. So perhaps the student was not able to grade a particular treatment with a particular client and were performing activities that were well below what the client should be challenged with. You can let the student know the specific examples and then tell them next time they treat that client, you expect to see an activity that is going to challenge the client appropriately based on the client's goals. This way the student knows what they need to work on. You can also set some clear boundaries, especially if it's things with safety or professionalism. You need to be very clear and say, I need to see this, especially with safety. So if the student is struggling, they know that they need to perform those safety skills without question. Those are often areas that students run into challenges with, and the supervisor really, it's not something that you can bend. Safety is critical, and the student must perform safely at all times. The last thing to do is ask for the student to also give feedback. Sometimes the student has some insight and is aware that they're struggling. So ask the student, how do they think they're performing? Make sure during your formal weekly meetings that the student is also evaluating themselves, because that self-insight is very important. This way the two of you can discuss the student performance, as they may have interpreted it differently than you. Now, once you've sat down and had your meeting with the student, you really need to make sure that they've understood what you've said and they're clear that they're having challenges. So I always ask the students to paraphrase back to me what I have told them, either regarding a challenge that I've observed in their performance or behavior, or exactly what I expect them to perform the next time I see them working with this client. So have the student paraphrase back to you. Also identify a few very clear things that you expect to see them perform the next time. You may need to give an example or two, and then make sure that they understand that. I encourage you to put that in writing. Students can be overwhelmed with the number of objectives that they know they need to address, but if you break it down into a couple smaller pieces and say, I absolutely need to see this in the next couple of treatment sessions, they'll have a better roadmap. Also, ask the student to talk to you or explain to you about how they are going to show these particular skills or abilities to you. Sometimes a student will say, okay, I need to go back and find a couple articles to show you where I came up with this idea, or that I am utilizing my resources. So it's really important that you ask the student to walk through with you how they're going to show you the particular skills or abilities that you feel at this point are not at the level you would expect. If concerns continue, it's really important to reach out to the academic representative and make sure that they know you're having concerns. You may need to set up some type of learning contract, or you may need to have a trial period where the student knows if this doesn't change within the next so many days or additional week, we may need to look at ending the fieldwork. So by contacting the academic representative, they may also be able to give you a little bit of insight into the student's particular personality. In other words, what things seem to work well for the student, what things seem to get them motivated or excited, or is the student holding back because they're overwhelmed? Those kind of things can be important information that you can get from your academic representative. If the student is still not progressing, again, you're still observing concerns with safety or problems with time management, once you've reached out to the academic representative and you've set up a learning contract, hopefully after a week or two you'll notice that things will improve. Sometimes students do need it broken down into much smaller steps. However, if things continue to not go as you anticipated, the student is not increasing their caseload, showing you appropriate clinical reasoning, and taking on more independence with communication, I think it's important to sit down then with the student and the academic representative, if you're able to do so, and let the student know that they are not successful on this fieldwork and it may be time to end the fieldwork. That's always a very awkward time. And after being a academic fieldwork coordinator for many years, there aren't too many times when I really have to sit down with a site and the student and actually end the fieldwork. There are usually other things we can do in between, like the learning contract, or changing up the schedule a little bit, maybe slowing down the pace, maybe adding on an additional week of fieldwork to give the student a little more time to make progress. But if you've tried all these options and the student is still either unsafe or not making progress with a lot of the other therapeutic skills that are important, it may be time to end that fieldwork. And that's when you sit down with the academic representative and the student and lay out exactly what you were not able to see in terms of student progress and what you would have expected. This way, the student is aware of what they'll need to work on in a future fieldwork should they be given a new opportunity from the school. But all of those things can be really important. Again, listen to your own intuition. Students need guidance and can be overwhelmed, but as long as you see small steps every week, not every student is going to be your top 5%. Most of your students are going to be average, typically progressing students. And every once in a while, you may have a student who's not and who's really struggling and needs either more time or will just barely get through the fieldwork without taking on a lot of extra demands. Not every student is going to flourish in every particular setting or environment. So keep that in mind. Not all of us can say that we're expert practitioners in every area of occupational therapy. One more reminder, there are some great resources available on the AOTA's website, as well as you can also work with your academic institutions or network to try to get more information about how to work with students on all levels. I hope that these little videos were helpful and you feel a little more confident of your own abilities to work with occupational therapy assistant students in the future.